Melflufen is interesting. So at its heart, it's related to melphalan, which of course is a drug that we've been using since the 1950s or 60s or so. Not so much in the low-dose oral form in this country anymore, but certainly still in the high-dose form in the context of autologous stem cell transplant. So melflufen has taken advantage of some biology of malignant plasma cells. Melflufen is essentially a prodrug form of melphalan, which has a lipophilic component to it. It gets readily taken up into cells, but then really for it to be active, it needs to be cleaved by enzymes called aminopeptidases. It turns out that myeloma cells very, very highly express these aminopeptidases, in part just because it's all in part of a plasma cell needing to produce lots of protein and then being able to degrade protein so that you can then produce more proteins. So because these myeloma cells have such high levels of aminopeptidases, they then cleave the melflufen into the active alkylating moiety. This active alkylating moiety then has a hard time leaving the cell, so essentially it gets trapped inside the cell where then it can act as an alkylating agent. So it's a very interesting way to much more effectively deliver high concentrations of an active alkylator agent more selectively to myeloma cells, and therefore avoid some of the toxicity that you see when you try to give higher concentrations of melphalan to the rest of the body.